name's Annika. I'm one of the women's officers for UNSW MedSoc. Today, for our second episode of our Women Crush Wednesday interview series, we're going to be interviewing Dr Karen Gibson. What's something fun about you most of the med cohort doesn't know?
I was thinking probably not many of you know that I used to have research sheep on the third floor of Wallace Wurth, housed in metabolic cages. There were about 8 up on the third floor. Pregnant sheep.
We had a lot of questions about your kind of career pathway and how you ended up in academics. So I was just wondering what your pathway was to becoming an academic and how can we follow a similar trajectory if we're interested?
First thing to point out was I did a Bachelor of Medical Science, which was a single year of research in the middle of my medical degree. It's a bit like what you have now in year 4 as an honours degree, but it wasn't part of the degree program back when I did medicine. And so it was unusual for people to do it. There was only about 4 of us in our year that did it. So I'd already had a bit of an interest in research. Anyway, then I finished my medical degree and went on and became an intern. And I must admit, I didn't do sleep deprivation very well. So I had a bit of trouble, particularly in the first half of my internship. And at that stage, I applied for an NH&MRC postgraduate research scholarship to let me do a PhD. Now, by the end of the intern year, I'd actually got used to it and settled down. I was actually quite enjoying medicine again, but I did get a scholarship. So I thought, well, if I don't take this scholarship now, I never will. The scholarship was for 3.5 years doing research at UNSW with sheep. Although at the start of that time, I was doing a little bit of part-time work at Prince of Wales as overtime, it got to the stage where I couldn't finish my day work to get to the hospital on time. And so I ended up stopping being a resident after the first year, and so just continued with my PhD. Then a job for a lectureship came up and I applied and took it. So I kind of fell into it, really. So I don't know that you'd necessarily want to follow a similar trajectory, because hopefully you won't find the first half of your internship bad. Probably to get the scholarship, it helped that I'd got publications from that BMed Sci year. It's good if you've had any research to try and get it published. It's good if you get the opportunity to do some teaching, to do that when you can. When I did my BMed Sci year, I did actually quite a lot of teaching on physiology and pharmacology prac classes at the time. So that meant that I had stuff that I could talk about when it came to getting a job in academia. I think just show you're interested and turn up and be conscientious, really.
Have you ever had any doubts about your career or career path? And if so, how did you overcome them?
I suppose I've had doubts a couple of times when I've seen other people from my cohort who were purely clinical, who were managing to get research grants and becoming professors in what seemed a much easier route than the academic route. But I wouldn't say I really had doubts. You've only got to think of sleep deprivation, and that kind of puts you back into perspective. The other thing too is being an academic's very good when you've got small kids, because the timing is a bit more predictable. My husband's an anaesthetist, so his hours are all over the place. And from a family point of view, it's helpful if you've got one parent who knows they'll be able to get away to pick up the children.
Our next question was, how does one get involved in medical education? Do you have to be an academic in order to do that? And how can we as clinicians do part-time uni work?
You certainly don't have to be an academic to be involved in medical education. I mean, you know yourselves from phase 1 that a lot of students liked having clinicians or GPs as their facilitators. So those people were GPs most of their time, but just a couple of afternoons a week did some medical education. So it's a case of looking at and applying if you see any job options. Clinicians are often contacting the faculty saying they want to be involved in teaching. There's positions going often with facilitation or clinical skills or tutorials. one thing that sort of always bothers me slightly is a lot of clinicians will contact us and say they're really keen to do some teaching, which means they want to give a couple of lectures, but they don't actually want to do any marking or any administration or any of those type of things. But that's all right. But certainly it is possible for small amounts of work to be done. And also maybe doing things like clinical skills. There's always education in postgrad courses too, and potentially in specialist fields. So a lot of senior registrars will give education things to people that are studying for their part ones for surgery and things like that.
The last kind of question is to do with our portfolio. So obviously we're women in medicine, and we're interviewing some of our role models that we kind of look up to. So I wanted to kind of chat about whether you ever had any struggles in your field that you've experienced as a woman with medicine, and have you had to overcome those? And also, do you have any advice for kind of female medical students who might be interested in a similar career pathway?
So for struggles, not so much being an academic. I was just sort of thinking about this last night in preparation, and my husband reminded me how when I was an intern, I was regularly doing ECGs on patients with chest pain in the wards. He never did his own ECG. He'd just ask the nurses and they'd do it. I'd ask the nurses, they'd point to the ECG machine. So there was a slight difference there. So just a couple of things like that, but look, nothing really major, and certainly hasn't been a problem in academia. As far as advice for female medical students, you might not be too keen on me giving this sort of advice compared to real career advice, but my advice is remember infertility and obstetrics problems all get worse after 35. So don't be so focused on your career if you want to have children that you leave it too late. Much better if you have to take a couple of years off and delay some training so that you can have your kids while you're at a suitable age to have them.